Here we go. Wait, hold on. Here we go.
You don't have to live in pain anymore. This is the podcast where you'll learn the stories, tips, and tools to get back to your path to health. I'm Dr. Dudum, and this is Back at It with Dr. Decompression.
Welcome to season 2. This is the Back at It with Dr. Decompression podcast. Man, I felt like season 1, we really accomplished a lot on what I was trying to do. Express my specialty in spinal decompression, what I do every single day as a practitioner. More about my story and why am I doing what I'm doing? Why am I so passionate about spinal decompression? We talked about different cases, different types of conditions, discussed with different and other practitioners, other chiropractors about what they do with spinal decompression. We even brought on a radiologist, Dr. Gatterman, and discussed how to analyze MRIs, how to analyze X-rays, talked about how I utilize his knowledge on certain cases. I'm really proud that of our team and how we're helping people with spinal decompression. This podcast has already gone across the country. I've had patients email me, message me through our platforms in other parts of the state and other parts of the country trying to get spinal decompression to help relieve their back pain and avoid spinal surgery. It's really cool. Some of these patients, now they can't fly in, although we're doing a program where that might be possible in the future. But for now, we've linked them up to other practitioners, even some of the doctors on the podcast, to get relief with spinal decompression. I'm super proud of the fact that more people are into spinal decompression, they're open to trying it, and they're getting the relief and living their lives, which is really all I want. That's all I want. So for season 2, I'm going to bring it. I'm bringing it harder for season 2. We're going to talk about more case studies. I'm working with Dr. Gatterman in one of the big chiropractic universities. We're working on getting a research article published. We're going pre and post MRIs. We're finding out how much of that disc bulge did reabsorb, the disc extrusion, the disc bulge. You know, we're getting a lot of pushback online, a lot of pushback with local providers that it's not safe, spinal decompression doesn't work, and it's just not effective. I'm bringing it. We're going to talk about case studies and show the pre and post MRIs. We're going to publish a case study to show the effectiveness, how safe it is, and how it works. It's not painful, it works. We're going to have more doctors on the podcast. We're going to reach out. We're going to have physical therapists. We're going to have nutritionists talk about inflammation. We are going to bring a whole slew of other types of practitioners on this podcast. The goal of season 2 is if someone has not tried spinal decompression and they've told that there's no other option except spinal surgery, I'm talking to that person right now about how we can help you with spinal decompression. If not me, one of our practitioners across the state or across the country. So buckle up. Season 2's coming. Thanks.